with the Continuum of Care program, and the Department of Housing and Urban Development is represented here by Juanita Price and Jackie Loy.
Thank you and good afternoon. It is an honor to represent HUD before this distinguished panel. I'm joined by Juanita Price and my colleague Fred Carnes. In the battle to address homelessness, there are two main fronts. First, policies and programs that prevent people from becoming homeless. Affordable housing, jobs that pay a living wage, and expanded social services. The second front is assisting those already homeless. While most of HUD's $28 billion budget is directed at the massive task of prevention, HUD's Continuum of Care is targeted at the second front, empowering currently homeless families and individuals to become self-sufficient. Here, the Continuum of Care represents two valuable innovations, one of policy, one of process. Since 1987, HUD's homelessness assistance was largely used for emergency shelters. HUD evaluated grant applications of individual homeless providers with little or no regard for how this proposal fit into the full picture of a community's response to homelessness. In 1990, the Shelter Plus Care program combined housing and services for homeless people with disabilities. Building on this concept, in 1993, HUD consulted with homeless assistance providers, homeless persons themselves, and others, and put in place a new approach, one that addresses the underlying causes of why a person remains homeless, meeting needs including job training, job placement, child care, housing, health care, and treatment for substance abuse and mental illness. This new outlook then drove changes in both policy and process. First, HUD changed the policy, making clear that the agency would fund only Continuum of Care efforts, a matrix of programs that intelligently combine a range of services and emergency, transitional, and permanent housing options to help people move from homelessness to self-sufficiency. We also doubled the homeless budget to $1 billion. Secondly, HUD changed the process, streamlining 5 applications into one and giving communities greater flexibility in meeting their needs, requiring in return extensive community collaboration. In fact, HUD now requires a single grant application from an entire community or regional area, encouraging all community players to coordinate their response, integrate their funding streams, and include all stakeholders. The result, HUD funds comprehensive plans for addressing the needs of homeless people, which communities often use as a roadmap to respond to other social challenges. What has been the impact of these reforms on homelessness? There are no current accurate numbers of homeless people, and HUD's innovation doesn't principally affect the number of people who become homeless. Again, that's a result of many factors outside of HUD's control. Instead, the Continuum focused on changing the very nature of how we address homelessness. So as many homeless people as possible become self-sufficient and are not just warehoused in homeless shelters. Of course, the real success of the Continuum cannot just be measured by policy or process reforms, but by the impact on people's lives, told by the aggregate numbers and the individual story. HUD increased non-federal dollars leverage from $38 million in 1992 to more than $1.5 billion in 1998. In 1992, HUD funded 180 projects in 150 cities. In 1998, we funded 400 partnerships, including 600 cities and 2,000 communities. The number of people being assisted in transitional housing increased from 45,000 in 1992 to 214,000 in 1998. 113,000 more children are being assisted today. Most importantly, 300,000 homeless people have moved to permanent housing and self-sufficiency since 1993. Juanita Price has graciously agreed to share the story behind these numbers. Her story.
Thank you. Jackie is right. The program that makes up the Continuum of Care impact lives. I started at age 13. It started at age 13 for me when I lost my mother until age 30. I was addicted to alcohol and drugs. As my life got out of control, I lost my friends, my family, and my precious daughter was taken away from me. On good nights, I slept in abandoned buildings, abandoned cars, and I ended up homeless on the streets of Washington, D.C. Two things that helped me to turn my life around: my own willingness to finally take responsibility in the Continuum of Care program that provided me with an opportunity to make a positive change. After facing my drug addiction head on and receiving treatment, I was able to take advantage of the Continuum program for homeless persons here in D.C. New Endeavors for Women helped me with housing and living, basically learning basic skills, giving me structure and discipline to my life. I was then able to move to Community Family Life Service, a 2-year transitional housing program. It helped me to build a foundation for living independently, teaching me basic responsibilities of how to pay my bills, to be a parent to my child, and maintaining a job. Through my hard work and support of these two agencies, I found a job. I went back to school. I now have my own apartment. I am currently a junior at Howard University, working towards a bachelor's degree in nursing. Most important, 7 years after separation, it brought me back with my daughter, Naisha. Thank you.
Let me ask a broad, I don't know whether it's a policy question or a process question. When I was reading your program description, I was focusing on the kinds of things that you were able to get done at the community level. I'm wondering about the kinds of relationships that you've been able to develop at the federal level, in particular the relationship among HUD, the Education Department, the Labor Department, and HHS with respect to the collapsing or the combining of resources so that you can affect the continuum of care.
Great, thank you for that question. We have been working through the National Interagency Council on the Homeless, which HUD co-chairs with the Department of Housing, with the Department of Health and Human Services and Veterans Administration, which is a very big piece of homelessness and addressing homelessness. We have been successful to a certain degree in collapsing the various programs into the Continuum of Care effort. On the local level as well, our representatives meet with the other agencies' representatives to see how we can bring these mainstream programs together. We actually give a point advantage in the competition to those Continuum of Care strategies that bring in the HHS dollars, that bring in the VA dollars, that bring in the Department of Labor dollars for job training. So both through the Interagency Council on the Homeless, our departments coordinate. There's two proposals, one before Congress to actually have a national demonstration of all funds for Continuum of Care with HHS.
As David Gergen said in opening this session, we're looking for hard evidence of what actually happens to people, which is very difficult for an innovation in process and policy. I'm wondering whether you have any evidence of people in local communities finding it a lot easier to do their jobs because you've simplified the process?
We hear that anecdotally every day. Also, Columbia University did 9 case studies, which we reference in our application, 9 different cities. Miami-Dade County was one of those areas. Cleveland was one of those areas, Baltimore. And in those cities and in that Columbia study, it is said that both the jobs were made easier and it was much more financially efficient as well as time-wise efficient coordinating. For example, New Endeavors for Women developed a relationship with Community Family Life Services. So once Juanita had successfully completed her program, rather than turning her back out, they were able to refer her.
So I gather that you have seen a proliferation on a local level of these continuum of care, of the continuum of care approach. Is that correct?
Absolutely.
And maybe, do you have any documentation of that? I mean, are most large urban areas doing this now?
Yeah, just about every large city in the country. Our documentation is the application process itself. In '95, we funded about 200 continuum of care strategies. In 1998, we funded more than 400 continuum of care strategies. So as it gets more competitive, the dollars also get more competitive, but we are seeing it done more and more successfully.
In terms of the lives of people, what is the best single point you would make? Is it the number of people who have moved into transitional housing? Is that move from 45 to 214,000? Is that representative of people who are once homeless becoming more self-sufficient?
That actually represents the beds we fund themselves. The best number, to answer your question, is the 300,000. Our most recent data shows that 300,000 people actually have completed graduation into a permanent housing situation, whether that be public housing, their own rental apartment, or some other form of permanent housing.
Once homeless, they were once homeless or now?
Once homeless, went through a program that was a partner with HUD in some sort, and they're now living in a self-sufficient or a permanent housing situation.
How would that number, 300,000, compare to before, to back in the early 90s?
The comparison to the period of 87 to 92 was about 20 to 29,000 people, again, based on the best available data that we have that Columbia University compiled.
Per year?
No, that was for that whole period of 87 to 92.
I think that completes the questioning. We thank you both very much, Juanita. We especially